Kathleen, and this is my health assessment vital signs video. Before I begin, I'm going to wash my hands for 30 seconds, and you can sing happy birthday 2 times in order to make sure that your hands are fully clean and all the bacteria and germs are off your hands. Now that my hands are fully clean, we're ready to meet the patient. Hi Claire, my name's Kathleen and I'm going to be your nurse today. Hi. What brings you in today?
Just to check up.
Just a checkup. And now is there any diseases or problems in your family history?
Just heart disease that I know of.
Do you have any allergies?
Nope.
Have you had any operations or surgeries in the past?
Nope.
Are you currently taking any medications?
Nope.
Okay. All right, so now I'm going to proceed and take your height and weight. Okay. You are 67 inches, so that is 5'7". Now I'm going to take your weight. I'm going to set the scale to 0, and then I'm going to measure. Okay, you're at a perfect and healthy weight. Now I'm going to take your temperature. You can take your temperature orally, rectally, under the arm, or in the ear. Okay, so I'm going to check the temperature through your ear because that's closest to your core, so we can get the best temperature that way. Perfect, 98.6. Perfect, because the normal range is between 96 and 99 degrees Fahrenheit. Okay, so that means you have a normal, healthy pulse. While I was checking your pulse, I also looked for elasticity of the veins to make sure everything was moving smoothly. And I also looked at the force. The force of your pulse was absolutely normal. It wasn't bounding. It was very consistent. And it was a 2+, which indicated that it was a healthy pulse. If it was 3+, that would mean that you would have bounding, and that typically happens if you're anxious. And 0 is no pulse at all. Okay, and then I also felt to make sure your veins were spongy and soft, and if there was any hardening, that would indicate that maybe you possibly have atherosclerosis, which is a condition that a plaque buildup happens in your veins, and it's hard for your blood to completely go out through your body fully. As I was checking your pulse, I also checked for your respirations to make sure that you were breathing at a normal rate. I did not tell you while I was doing this, so you did not control your breathing or change it. I got 12 breaths per minute, and I got that by counting for 30 seconds and multiplied it by 2. A normal respiration rate is 10 to 20 breaths per minute. I was looking for a symmetrical chest expansion, and if one lung was rising more than the other, this could indicate a pneumothorax, which is a collapsed lung. I also checked to make sure that you didn't have pursed lips or a hunchback. Okay, now I'm going to take your blood pressure, so if you could keep 2 feet flat on the floor. You got a good reading. I'm I'm going to make sure that the blood pressure cuff is not too tight or too loose on her, and it covers 60% of the arm. I'm going to have the arrow pointing down towards the brachial artery and make sure that it's placed 1 inch above the brachial artery. Perfect. You have a healthy blood pressure of 120/90, and a normal blood pressure is 120/80. So you look like a healthy girl, and you're ready to go.